everyone, welcome to the live stream. I am so excited to be with you guys here for another Saturday AMA, and I've gotten the wings. Brian Quee is going to be joining us in just a moment. I'm going to be talking with him about some things in inpatient coding, some CDI. So it is a hot day here in Pennsylvania, 90 degrees, very different contrast from last week where I was freezing my butt off. It is actually quite warm today. Hopefully I can make it the whole hour without having to turn my loud air conditioner on. But again, so happy to be with you guys today. If you could just say hi in the chat to me, say hi to your friends, let me know that we're doing okay. Everything sounds good. And right now we're just going to go ahead and we're going to start the live stream. All right. So thank you everyone for coming on today. It is so great to be here. I have been having a great time bringing on some guests onto the stream and onto the channel and onto the podcast. So this week I was interviewing Sam Lipolis. If you haven't checked that out, she is a telehealth expert. So I recorded her whole session, edited it down, and she is on earlier today to talk about some just interesting stuff with telehealth. So hello to Nalim. Great to see you here. Lillian, awesome to have you here. Yeah. Oh, glad. I'm glad everything sounds okay. I know sometimes I've made some tweaks over the past couple of weeks, and I think things are going pretty good. So hello to Lenora. Great to have you here as well. But yeah, so I have a couple of people. I've got another recruiter coming on next week, which is going to be phenomenal. I always love to give you guys feedback based off of my experience and things that I've done about Bertram on, so you can get information from him as well. And then now I have another recruiter coming on next week to give some additional insight. And I think that's just going to be really helpful. I mean, the information that he gave, I think is just really going to be crucial. Asked a lot of the questions that some of you were bringing into the community. Hello to Lenora. Happy to have you guys here today. So I don't want to wait too long to bring on my special guest. So hello, Faye Wynn. Hey, Patty, good to see you here too on the chat. Mindy, hey, it's hot in Ohio. I'm hoping it sticks in next week. So I'm actually going to take off on Friday. Please, nobody text me, nobody call me. I am going to be actually taking a day off on Friday and going to the beach with my kids. So we're going to have a fun time. Hello, Mary Jane. So do you guys want me to bring on Brian? Do you want to have, because he's going to be here. We're going to talk. We're going to have some good conversation, and you guys can definitely be asking questions along the way. I believe he can see you guys in the chat as well. Brian, give me a wave if you're ready. He's waiting in there in the wings. I'm going to switch over to my headset because I don't want to accidentally have any echo coming on here. So let me just turn this on real quick here. All right. And here we come. Hey, Brian, welcome.
Hi, everybody. How are you?
It's good to see you here. Oh, wait, hold on. It is coming through my speakers, not my headset. Let me switch that over. There we go. So I should hear you now through the headset so we don't have any echoes.
1, 2, 3. How am I?
There we go. Awesome.
All right.
Great. It's great to have you here, Brian. Was everything okay with setup for you?
Yes.
Like super easy, right?
Easy. I'm liking this platform, StreamYard. I'm like, as you're doing it, I'm like, wow.
I know. I'm like,
so cool.
This is my contemplation that I've been having for the past few weeks. I'm like, if I bring Brian on as a guest, these are the two.
We're gonna have so much fun. I'm gonna geek out on this stuff.
First off, like,
I'm not even paying attention to you because I'm looking at all this StreamYard stuff.
Brian's going to be looking at StreamYard, and then he's going to go on StreamYard. And then I know Brian, he's going to be like, everybody, have you heard about StreamYard? It is this amazing platform. You can
I'll give you credit too, you know? I've always given you credit. Remember that.
That's true. But yeah, so this is an amazing platform. But because I want to take one second away from my audience to tell you about what I do with StreamYard. So you can use StreamYard just as it is, and it's so phenomenal. But I actually have it feeding into OBS so that I can do my screen shares too. I'm not today because we're chatting back and forth, and it sometimes slows down a little bit than the rest of the stuff. But you could do some pretty neat stuff then with having both of them set up at the same time.
Interesting.
So let's get into some of the questions. Hey, first off, let me talk to Precious. Precious is saying, if you do well on my practice exam, does that mean you'll do on the real exam well too? Likely so. Likely so. If you're getting like an 80% on my practice exams, anyone's practice exams, usually that's a pretty good indication that you are like ready to go. So today I want to talk with Brian Quee. So Brian is one of the people who's very prominent. You've likely heard of him before, the Medical Coding Geek. You have Facebook groups. You're doing all kinds of social media stuff here now. You have been a podcaster for a long time. You are actually one of the pioneers of podcasting in the medical coding, in the HIM space. And you've interviewed like dozens in this field to get their stories, right? But for some of my listeners that aren't familiar, can you tell me a little bit about your backstory?
Sure. So before all of this podcasting stuff and YouTube stuff, it started out, well, I'm gonna try and do it a different way, because I've always told this story, but I try to do it in different ways. But what got me into healthcare was because of a sprained ankle. I'm gonna start right there, because I was playing basketball in middle school, and I went up for a layup. I busted my ankle. I was out for 8 weeks, and I'm like, boy, what exactly happened to my ankle? And so I did some research, and I'm like looking around, and then eventually I found myself to being interested in physical therapy, right? So when I finished high school, I'm like, okay, I'm going to be a physical therapist. That's what I'm going to be. And either that or my dad said, you could be an engineer. I said, well, what's an engineer? What am I going to do specifically? So I was actually initially going to be physical therapy. But then this was back in 1998. And my mom said, no, don't go to physical therapy, because right now it's saturated. Because if you go, there's not a likelihood of you finding a job. I'm like, okay. And that's as I was entering college. So I was just kind of stuck. And so eventually I found myself to going into nursing, but I didn't do so great in anatomy physiology. I didn't do great in microbiology, so I could not get into the nursing school. So I found, what else did I look for? I looked at biomedical engineering. That was interesting, but it wasn't my thing. I thought about pre-med, but then I didn't want to have debt. I went to career services, and I was actually, before I even thought about medical records or HIM, I was actually going to be I considered being a medical technologist, like doing laboratory work. But then unfortunately that program closed as I was getting in. I qualified, I got all the courses in, I was ready to go. And this is, oh no, the program's going to be closed. And so I'm like, boy, I'm really stuck here. And what do I do? And so I went back to career services. I pulled out a pamphlet, and the pamphlet had a formula, and it was healthcare plus technology equals success. And so I was like, okay, what's this all about? And so it led me to health information management. And so from there, I took the program, I finished it, I did great, graduated in 2003. During that time, I was working as a radiology film librarian. So this was before PACS, digitization of radiology images. So I was filing library film library. And then I graduated, and then the HIM director that I was interning with, she hired me as a HIM technician. I did that for a few years. I got my RHIA from the AHIMA. I decided, you know what, I'm going to go over and take over the world, because I have this new shiny little credential. Right? I'm like, oh, this is so shiny. I think I could do some more, right? So I did what I did back in 2004, 2005. I think what was the job search engines? I think it was a Monster, right? Monster and Career Builder were the big ones, right? That back then.
Yes.
And I went in there, and I'm like, okay, what am I going to find? What am I going to find? Medical records director, right? Versus HIM director. And then I found one that medical records director for a jail system in South Florida. I had no idea which county it was. I know it was nearby. I didn't know the schematics of the of the jail system. And I decided to take it, because I felt that as an HIM person, that was that was the direction that I needed to go for. I'm like, okay, they hired me, and I spent the year just coming into a super antiquated department. It was all paper.
I mean, it sounds interesting, right? Like I would think
It
working for
does.
like a jail system,
Yeah.
well, at least I'll see some interesting stuff while I'm there, right?
Yes, yes, you will see some interesting stuff, a lot of interesting stuff, but everything was paper. Uh, the filing system was done alphabetically. Most hospitals would do terminal digit by the last 4 or 6 digits of the medical record, but it was done by the last digit. I'm sorry, last name. So everything was just like all squished and everything, and it was not evenly distributed. On top of that, all of their archived medical records dating back to 1996 was not inventoried. It was just put somewhere. So could you imagine if somebody came, like a lawyer came to me and asked me,
Yeah.
hey, medical records for this jail system, I need one page from 2000. Where am I going to find that one page? And nobody knew. So I had to go back and re-inventory a whole warehouse of medical records. Spent a year doing that. And then I'm like, okay, what do we do next? Let's go ahead and scan. Let's go ahead and, get these services in and kind of do some, take out these medical records, because I am not the one who's going to do it by myself. And unfortunately, they could not grow into that type of system. So from there, the HR generalist from the previous employer that I worked as an HIM technician called me up and say, hey, we have a position for you. It's a CDI specialist. I'm like, what? So CDI what? And so before I had left, I knew about CDI because before I left as an HIM technician, the actual consulting company came to our department and did a full assessment and audit. And the last thing that I had seen was coders and the consultants just like at wit's end like this, like, you're wrong. Let's agree to disagree. And that was the kind of the taste that I had before leaving to the medical records director. But anyways, they called me up and they say, hey, would you be interested in being a CDI specialist? I don't know if I want to do that because I had a really bad taste in my mouth. And really, it wasn't something that I wasn't interested in, but I figured, CDI is something new, right? If they're giving me an opportunity to do something new, I would be one of the first ones, early on in the game to get in. So they said, you know what? I told them up front, my coding skills are not that great. It's very basic. I mean, it's back to just when I was in college. My clinical skills are garbage. I have no idea of what anything is except for the medical term for inflammation, which is itis. That's all I knew. And maybe some terms, maybe something, but I told them that I was very upfront. I don't think I can do this. And they said, you know what? I think you can, because the reason why we're reaching out to you is because you have your RHIA. And I believe you have the very, 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 very basics to at least do that, because we are going to train you. And I'm like, really? You're going to train me? And so I'm like, okay. And on top of that, Brian, we're going to give you a bonus. And on top of that, we're going to increase your pay. I'm like, what am I waiting for, right? Well, I've always told myself, what's the worst that can happen? If they're offering you all of this stuff, what's the worst that can happen? And so I said, okay, all right, I'll do it. So I left the jail system and then started as a CDI. I did it for 9 years, right? But in total, I did it for 12 years. And up until year 9, I just needed something more to do. And this was, what was this, 2006, 9 years later, 2015. So this was the time where the ICD-9 was being transitioned to ICD-10. And I said, let me do something different. Let me do something new. And so what had happened was I tried to get another CDI position, but unfortunately there were some changes and something happened in the landscape of CDI where they wanted only nurses, right? So
Yeah, I remember that.
2009, I felt I'm going to say the term. I was pigeonholed in my position. Like I'm doing the job, but I can't go anywhere else. And I'm like, you know what? This really is not great for me. And so what am I going to do in the meantime? And so what had happened is that I decided to let's do tutoring. Let me help somebody. I want to help somebody. So I figured let's do some tutoring. Did a Google search. There was no websites on medical coding tutoring back then. There was only one. And then when I started, I became number 2. Right, number 2 on the search. And so I kept on getting floods and floods of inquiries. And I'm like, what's going on here? And then it didn't click because, 2015, ICD-10, everybody was asking me about how to train in ICD-10. Fortunately enough, before 2015, I was already being educated for 3 years. Right, it was excruciating to me.
Okay.
So I was from ICD, every chapter in ICD-10 for the diagnosis, PCS, and I already had that 3-year education in my belt. So I just started to share my experience, and that's how I did it. And from there, I figured I need to make something more out of this than medical coding tutoring because it's taking a lot of my time. And so I figured people are asking me the same questions. So I figured let's make something different. And so that's where Medical Coding Geek came from. And so I decided to create that. And then I went into Facebook groups. I was introduced to Facebook groups. Actually, I went into Facebook groups, and it was somebody by the name of Lori Woods, which, by the way, her husband is turning 60 today. So a shout out to her husband, Barry, if Lori's listening. She brought me into her group. Back then it was called Create a Coder. And then from there, she showed me the ropes. And I said, let me just do my own, right? So I created my own group, Medical Coding Geeks. And then from there, it kind of snowballed, right? And then from there, I created other groups, an HIM, HIT, exam support group. I created a CDI group, and it just keeps on growing from there. Years later down the line, I said, you know what, two years after creating those groups, I decided to make a podcast because I feel a lot of the discussions being made on social media needs to be brought out as a discussion rather than somebody typing out. So also, I needed to network too. It was a selfish reason. And I decided, let's start a podcast because nobody else was doing it in our field. There were a few. I could name a few. I know ICD-10 Monitor was one of them.
Mm-hmm.
Actis had their podcast, but it was not a podcast. It was a webinar, recorded webinar that they put on their website.
Mm-hmm.
They didn't put it into Apple Podcasts. And it wasn't until I told the director, Brian, I said, did you know you could put your stuff on Apple Podcasts? He says, oh, for real? And so that's why you see that change from Actis Radio to the Actis Radio podcast.
I've noticed quite a bit in the industry. There seems to be organizations specifically tend to do that they'll put out an audio file and they'll be like, oh, we made a podcast, enter your email address and your name, and then we'll give you the podcast. And I'm like, that's not, that's a lead magnet that you're trying to get people's email address for an audio file. That's not what a podcast is.
Right. They should be easily accessed whenever they want. What podcasts are is, at least for me, you could do it through Apple Podcasts, Google Play, Google Podcasts, and there's a whole bunch of other ones, Spotify. You have the ability to subscribe to those, something similar to YouTube. You can subscribe to that podcast. You could download the episodes for future reference if you're traveling, if you're going in your car, you're commuting, whatever. And I thought this must be a great way because, with podcasting, you're not just limited to one platform. You're blasted out to every platform out there in podcasting. That's what's so great about it. And I'm like looking around, I'm like, there's not that much. And so I decided, let's just do it. And so I studied, researched the same thing I did with this YouTube thing, right? The arduous process of getting a microphone, getting a mixer, learning how to connect it all. And I didn't even have a real guest. I just said, does anybody want to talk on a podcast? And I picked up Charlita Huffman. I believe her name is now Charlita Whitehead. And so now we're approaching our 100th episode in July. So I'm going to bring her back on. And so I've discussed a lot of people, talked with a lot of people, learned how to interview. I think that's most important. They find that when I interview people, at least with my last guest, it was my supervisor from way back when I was a CDI. She felt it to be therapeutic because I think that's what people need, right? When we talk to each other, we ask questions. Sometimes they don't realize who they are and what they've done until they say it. And everything's laid out. And I tell them, I lay it out for them. And then at the end, I guess my technique is let everybody tell their journey. And I take some bits and pieces of their journey and I bring it out to them. So did you know you talked about this? This is something that if you're regrettable now, look what you did in the past. And that's something that you could do now. From there, the podcast 2017 is when I created it. And now YouTube. So I've been, kudos to you, Victoria Moll. You've been one that I've named a lot. I know your ears is very itchy. Every vlog I've mentioned it. Every podcast I've mentioned your name. If it's YouTube with medical coding, it's Victoria Moll. And I remember there's one time. I love this one where I was talking to Marlene Marino on her podcast. I think it was the Includes podcast. And
Yes.
yeah. So here's the thing. So here's what I was doing. I felt I was sleeping, right? I was sleeping. Then I had to use the bathroom, and I went back to bed. I said, let me, this is what I do. I always before I go to bed. And I go on Instagram. I'm like, oh, she has something. I usually check, the stories. And there you are, like 12 midnight, just listening to a podcast episode. And you're like, listen to this. And then my voice comes on mentioning your name. You start laughing. I'm like, is this what she does? She's waiting for me to say her name. I can say your name all you want.
I don't even remember what social media platform it popped up.
It was
on.
Instagram.
Maybe
For me, it was Instagram.
Well,
yeah.
no, I don't remember if where I heard that the podcast was up. It might have been LinkedIn or something. I don't remember. Okay. And I remember seeing, we're bringing on Brian Quee, and he's going to be talking about YouTube and his YouTube channel. And I'm like, just wait, because I know this is coming.
But you've done a lot. I mean, every time your name is brought up in conversation, I mean, you're ahead of the game. You're one that I always look toward too, because right now I think we could talk about this, but live streaming is the newest thing that you have worked on. I've seen the progression in the quality and everything. StreamYard, I love StreamYard. I just found out through Think Media
Yes.
that I saw it. I'm like, StreamYard. All right, we're gonna use that. And this is the newest thing, having conversations, bringing them out and bringing and pushing it forward live. And so that's what I think the future is. But now, and then let's see, YouTube is in the works. I'm still working on that. We'll talk about, I know you have a question about that, but that's where I'm at now. Currently as a full-time job, I'm doing, on top of everything else, I'm a clinical validation auditor. So I moved on from CDI. And I now work for the dark side. And so I work for the payer side. Yeah. So, and so I do all of that. But it's an interesting. You never knew about that, right?
No, I didn't. I remember your job like a job or two ago, kind of knowing who you were working for. And then kind of like you keep kind of quiet about like what you're actually doing from day to day, which is respectable, like completely respectable.
Yeah, I don't want to get in trouble.
Right.
But yeah, it's an interesting position because it's nice to go on different sides of the spectrum, right? So if you're an inpatient, go to outpatient. If you are a for-profit, try nonprofit, or the other way around. If you're working for a provider, work for the payer, right? You see different perspectives. It opens up your perspective a lot on healthcare and how the industry works.
Okay. I want to go off script here for a second because something came up the other day, and I definitely need to make sure I bring this up because I'm curious if you saw this too and what your thoughts are. So you know how I guess it's AHIMA is it the CDIP certification, right? Certified Documentation Improvement Practitioner. Is that theirs? And then AAPC has one that's the CDEO, Certified Documentation Expert Outpatient. So I was on the AAPC website, I don't know if it was the day or two ago, and someone posted that they had just passed their CDIO certification, Certified Documentation Inpatient, or CDE, whatever. They're Certified Documentation.
CDE, right?
Something like that. They're Inpatient Coding Expert Documentation Improvement Person certification. Not on the AAPC website yet. So obviously they've been testing this, and I don't know if maybe this person wasn't even supposed to say that they were passing the certification exam, but definitely interesting, I think, to see the transition now that AAPC is trying to get into more inpatient coding. And now they have their own kind of CDI inpatient certification that they apparently are testing for.
Yeah, I saw that. And here's my take on it. So the CDI certification for AAPC compared to, let's say, the CDIP compared to the CCDS, right? And so I was there before everything, in terms of the CDI business market came in. So I think it started around 2010. Right. So when ACDIS came about. And so when Actus came about, then HEMA scrambled. Like, okay, we have to jump on this, right? And they created, which actually I actually interviewed Brian Murphy, who is the director, and his premise was, there was a need for it, right? And anything like AAPC, a HEMA, AHIMA, there's a community that's built, and they want somebody to lead them. They need some guidance. And so that interview with Brian Murphy, he talked about like there was a need for something to step in and kind of guide them through. So that's where Actus was born. And from there, they created the CCDS. And I saw that. I'm like, ooh, I want to take the CCDS, but I don't want to pay another association fee, and I don't want to be the guinea pig. So I kind of held back. And I was actually waiting for a HEMA to create something similar. And eventually they did, the CDIP. And I'm like, oh, I'm not going to be that guinea pig because there's no study guide. I'm not going to do it. I'm not going to do it, right? So I couldn't wait anymore. So it was like 2015, after ICD-10 was implemented, everything, October. I remember the October 23rd, 2015 was when I took the exam. Can you guess what happened right after, when 2015, 2016, you know what they created? They created a study guide for the CDIP. And I was kind of disappointed. Like, they had 300 questions. Like, well, but the thing is, I had, 9 years of experience. I looked at the exam as an experienced CDI as each question is a scenario of something that I did. When I looked at it, I'm like, okay, my question to myself is, where does this fit in my line of work? And how would I address it when I'm brought into this question? So for the CDEI, right? I think that's what it was. Go back to the question. Let me go back to the question. The comparison, right? So the CCDS.
Here's the question. Here's Brian.
Yeah. I'm going all the way around. That's why you can never get like a certain time frame. But okay, CCDS is, to me, and I actually studied for it. I studied with the study guide for my CDIP, and it's more like as if you are a specialist, right? If you're a specialist performing queries, working in department. I found the CDIP to be more like as if you are a manager, if you're overseeing the program itself, making the program grow, dealing with metrics and etc. I feel the CDEI could be a stepping stone, probably, to CCDS, a stepping stone to CDIP. That's something to look forward to. I mean, there's a lot of, for example, if you have a CPC, you have a CPCA, you go to CPC. If you go from CCA to CCS, I believe this could be from CDEI to CCDS or CDIP. So if you want to get your foot in the door and trying to get into CDI, I think probably the CDI would be a great stepping stone into the other CDI credentials.
Do you feel like it might just continue to promote people with their alphabet soup, that they're just like, look, one more credential for me to get. It's new and it's shiny and I'm going to get that.
Yeah. I mean, when you look at going for a certification, and I talked about this with Marlene, right? Because she has the alphabet soup on top of the academia soup too. She has masters, and I think she's being pushed for her doctorates. There has to be, whenever you're in your career path, there has to be a need for that credential, right? So if you're going a certain direction and it requires that type of education, then go for it, right? If you're doing CDI, go for a CDI certification. If you're going for outpatient go for CPC or something along that lines within that specialty. So depending on where you're going, I know Marlene has a lot. She has CPC, CDIP, I know CIRCC. She has 2 masters in health informatics and 1 in education. And I'm like, dude, when are you going to stop? But the thing is, what's nice about it is that her employer is paying for it. So when they're paying for it, I'm like, okay, let's do it. So it depends on where your direction is going. But alphabet soup, hey, it's great as long as it's not too salty.
Okay, so let's get back to some of the questions that I did have planned a little bit for today. So when you think about everything that you've done now, working in the jail system, working in the payers, the podcasts, the social media, now your plans for the future, like looking back, did you think you would be on the path that you're on now?
No. When I finished, maybe you want a short answer? No.
Next question.
Yeah. When I was in college, I knew right away I hated coding. I hated medical coding. Can you believe that? And so, um, what happens is that I had an aspiration to be, in health information technology, working in IT, developing electronic health records, because that's where at the time that I had graduated, that was what was happening, is where we had hospital systems transitioning from a paper-based system to an electronic health record system. I said, boy, that's where I need to be, not in medical coding. And so I took I finished. I'm not going to be a medical coder. No way at all. And so I did the HIM thing. I did the HIM director thing. And then the CDI came in. I'm like, oh, after, that type of attitude coming out of college. And then it came to me with CDI and it involved coding. I'm like, I don't know if I want to do coding. And so, but I always tell myself, what's the worst that can happen? If you take this, if you're doing something that you don't like, I think it'll just make you better. Right. So I decided to take it. Every opportunity that's been brought to me is because I decided to do it. I mean, I didn't have to do it. I mean, it's like I didn't have to do podcasting. I didn't have to do a YouTube video. I didn't have to go into CDI. But a lot of the stuff in terms of what I've done in networking in the field, people are bringing me opportunities. Hey, would you ever consider doing this? Even teaching. Teaching was something I told you that I did. I went to a college, right? Trying to get a second bachelor's. I don't know why. For I think it was biomedical engineering or something like that, within something biomedical. Anyways, I went and did the application. I did the admissions process. I left. And then the school called me and they said, would you be interested in being an HIT instructor? I see that you have an RHIA. I'm like, what? I didn't even consider myself to be an educator. I just wanted to go to your school. And I said, no, we need an instructor because there's nobody else that can do it. And you're the only one within our area that has an RHIA. I'm like, okay, let's do it. What's the worst that can happen? Right. And so all of these things that I've been, that I've done, that's pretty much been given to me, that I never thought about going in that direction, has kind of built itself into today. Medical coding was brought to me because I didn't really want it. Education was something that I didn't really even look into, but I took those things and kind of leveraged myself in my career.
Yeah. And speaking of leveraging yourself in your career, with the podcast and everything, I don't remember if it was last year or around that time, right before the pandemic, you were saying about how for the year 2020, you wanted it to be the year that you were going to go out and live interview people, that you already had people like in your mind, like these are the people I know are in Florida and I could probably meet up with in person. And I think you did with Tony, right?
Yes.
Like you two actually met in person. And then it was like right after that, I think was soon after the pandemic happened. And you weren't able to pursue your plans of kind of taking the podcast on the road and going to conventions. Now that restrictions are kind of easing up, are you planning on revisiting that and maybe starting to do some on-site podcasting videos and stuff?
Let me tell you something. When the first one that I did was Lee Antoinette, right? So it was in Gainesville. It was I had spoken at an event early I was the first one, 7 a.m. And I had driven 2.5 hours to get to Gainesville from here in Central Florida. And so Lee Antoinette called me out. She says, I want to do an interview with you. And she drove 8 hours from Atlanta to meet me in Gainesville. And so I did my CDI session, Coding Fiesta, for the North Central Florida AAPC. And I did my session, and then there she is waiting. So I brought my podcast equipment, my 2 microphones, and I'm like, I don't even know what I'm doing. And so I decided to do it. And it was that kind of sparked my interest in in-person interviews. The second was Tony. Did I ever tell you? Did I ever tell you a story about that? So I was on vacation at that time. I was doing a staycation, and I was just we were using one of our timeshares, and I had connected with Tony. I said, "Hey, do you want to do a podcast episode?" And again, the on-site thing was kind of like, "Okay, do you want to come to the resort where I'm at and kind of chill out by the pool?" And she says, "Sure," but I didn't know the schematics of the resort, so she had a drive to the parking lot, and she didn't know. She was in the lobby, but she could not get in. And where I had set up the podcast. I had to scope it out because I couldn't do it in my resort room because my kids were sleeping. My wife was there. She didn't want it inside there. So I'm like, oh, let's find something. So I found a pool area, a second floor balcony with chairs, fans, everything. Wonderful. I gave her water. And I had to pick her up in the lobby, and and she didn't know we didn't know how what we looked like. And so I drove up to her, and she thought it was kind of sketchy. Like I was picking her up. Like, I don't know who you are. She says, I got to tell you the truth. It's kind of sketchy because you're driving up to me and you're telling me to get in your car. I don't even know who you are. I'm like, okay, I'll calm down. It's okay. I understand. So anyways, she came in. We went in, and it was just, I don't know. It was tough because the weather was great. But the thing is that I didn't expect the lawn service to go in our area. So if you listen to the episode, you hear, right. And we're trying to focus in on what we have to say. And it's just so hard. And I said, you know what, Tony, I'm just going to pause the recording, let these people finish out, and then let's just continue. But that was a thing. So I do intend to do in person. My goal was to attend conferences. I had HIMSS, lined up. I was trying to get somebody there in the Orange Convention Center. I wanted to do a HEMA. I was going to go up to Georgia, right, and do all of that. And also AAPC. I think they had one in Dallas, right? I was just going to go there, find somebody, and just do a podcast interview. I was like, oh, that's great. But then when the pandemic hit, it kind of derailed it a bit. And so, but what's great about it is that it led me to Zoom. I never thought about using Zoom as a platform to do interviews. That's what kind of sparked the YouTube a little bit, was using the Zoom. Surprisingly, before when I started the podcast, I was using a phone line. I called the person, I connected from the cell phone to the thing here. And I'm like, why couldn't I just use Zoom? Zoom was already there when I first started the podcast. And but hopefully from there, moving forward, I would like to do more in person. I think it's better because when I did it with Lee Antoinette, I got a sense of how to work the conversation. You see when they're going to finish. You see when they're going to begin. You know when they're going to toss it back and forth. Right. That's something that's great with in person. Also, it's just nice to meet that person in person.
Yeah. I did one recently on riverside.fm, which is kind of similar to Zoom, but I guess their features there will help enhance the audio versus the video so that they make sure your audio is really good prior to, the video bandwidth or whatever you want to call it. But so that was really good. And then, gosh, now I totally just lost my track. What was the other thing I wanted to say in regards to? So usually AAPC rotates, and every other year they're at Disney. So I thought for sure, I'm like, oh, well, this will be great because I'll be down at Orlando for the 2022 convention. But now they switched it this year, and it's not. It's in like Washington, D.C.
Oh, they changed it. Oh, darn. Yes. Oh, no. Come on, hey, AAPC, you got to bring it back, man. You were, I think the last time you were in Orlando, it was the Coronado Springs, and they've expanded it. They added a tower. I know Coronado Springs has the best nachos, and so we just go there. I live 2 exits away on the main highway, and I'm right there. It's like going to the grocery store. So if anybody was there, or whenever there's conferences there, I kind of get excited. I'm like, great, I'm just right there. Let's do something. Let's kind of meet up. Also, they changed it to what? Washington D.C.
Yeah,
or Washington all the way in West Coast.
No, Washington D.C.
I
mean, it's kind of nice because it'll be like right when the cherry blossoms are about to bloom.
Okay.
So I've always wanted to go to the cherry blossom festival. So I'm like, well,
way,
at least I'll kind of get to see that. So. Not as good as Disney, though, because there's no Mickey Mouse at Washington, D.C. No Pirates of the Caribbean there. So what do you think has been the biggest change for health information students now versus when you started out?
As I mentioned before, when I graduated the HIM program, the status of the industry was the transition from paper-based to electronic health records, right? And so I've mentioned this before. Now we're in a state where we have electronic health records, but now we have a lot of data, right? Because when you create or use a system, the electronic health records, what it does is that it gathers a lot of data. But the question is, what do you do with that data, or who's going to look at that data? Even with CDI, there's systems in place, but people don't really look at the data itself. and use it to leverage it in a way that they can take the next steps. So I believe now the biggest importance of HIM students, HIT students is health data, right? And so we have to know how to look at it. We have to learn how to interpret it. We have to learn how to report it. This is why programming is important. I look at it now, I'm like, I don't even know how to do that. If I try to get into that. Surprisingly enough, my wife is back in school, which I didn't tell you. Me and her, we graduated with the same major. We graduated together in the same program. That's another story. But
I thought your wife was a nurse.
Yes. So we graduated together as HIM, right? And then she was a staff accountant for a property out in Miami, Aventura. She was a staff accountant making lots of money, right? And then so she got her RHIA, and then she's like, okay, what do I do next? And so when she tried to look for a job, all the pay was kind of low. She's like, I'm not going to go backwards for this. Yeah. And so she kind of let her RHIA lapse, and then she went into nursing. And so now, so she did her nursing. She graduated in 2010. She's been a nurse since for almost 11 years. And now she's getting her bachelor's. She got her associates, getting her bachelor's for nursing. And now she's going to look into getting a master's in health informatics. And so I told her, when you finish that, I will do it, because when we joke around in college, she used to come for me for the answers. And now when she's going to go do her master's, I'm going to go to her for the answers. I'm going to go to the same school, take the same classes, and hey, can you hook me up with the notes? So that's the idea. I think that's what happens now also, is that there's a greater need for higher level education, right? So normally you can get a job with, high school degree. Now I've seen a progression needing an associate's. Now there's a progression in needing a bachelor's, right? And so now we're in a stage, not just our industry, but a lot, every healthcare industry is now needing a master's. So I think I'm at that point now where, like, okay, I'm always pushed by the industry. Wherever the industry goes, that's where I will grow. So like if you needed a CDI credential for CDI, well, that's where I want to grow. If I want to get into health informatics, well, I think I need a master's for that. So that's probably the next plan for me.
Do you feel that the degrees and the credentials are still needed for CDI work? Because it's interesting to see the difference between like a HEMA who's like, you need to have a bachelor's degree or you're not getting your RHIA. That's a requirement of it. Versus now the AAPC who's like, we'll take anyone as long as you can pass the exam.
Yeah. For CDI, if you look at the landscape of jobs out there in the industry, they would probably just require an associate's or a high school degree. But if you really want to get into a good team, a predominant CDI program, they're going to ask for a bachelor's, right? Because it's a mature role. I feel it's a mature role from coding. Could you get into CDI? Yeah, but you have to be mature into it. And in order for you to be mature professionally into it, you have to have the education, the experience to get into that role. So I believe, like, to get into CDI, do you need an RHIA? Is it enough? Well, back in 2006, it was. I can tell you that much. But now, I mean, I'm talking to you when it was, let's say 2009, we had that change and where they only wanted RNs, right?
Right.
And
actually, to be honest with you, when AAPC first came out with their CDI credential, people were asking me like, oh, Victoria, do you think I should go out there? I'm like, don't bother, because they're only hiring RNs for CDI jobs. Like, I don't think they're just going to take a credential alone. Yeah. But we have started to see that shift back now because of people like you just making their voices known and going, hey, just because I don't want to catheterize a patient doesn't mean I don't know clinically what's going on.
Yeah, that's what happened. Is when I transitioned to creating the tutoring, the medical coding geek, that's where I was. I was at a point where I'm pigeonholed. Where do I go? And I cannot get away from, my job that I was doing at CDI was great, but I wanted to see more than just the records that I was doing in the healthcare system. And so I was pigeonholed. I went to countless recruiters, countless employers. I passed their test. I wowed the interviews. And they're like, you have great experience. I think you fit into the role, but you don't have your RN. I'm like, come on, man. So I really got mad and depressed at the same time because I'm like,
Right.
what am I going to do? What am I going to do? And the only way I could do it is I went straight to LinkedIn. I said, look, this is totally garbage. What happened to the industry when I first came in? It used to be a diverse system where you have coders and RNs and whoever in the landscape helping each other out. Now, with all of that vocal stuff and just speaking up, I think that's what's important now is that you really have to speak up in today's industry. Don't let the organizations kind of lead it. Have the members speak up and kind of talk into it. So what happens now is that we have now medical records, medical coding, nursing, and even ancillary. We would never think of respiratory therapists, LPNs, lab techs, considering to be CDI professionals, but we do have them now, right? I did a podcast interview with Brian Simpson.
Brian Simpson, yeah.
There you go. Yep. He was a respiratory therapist, and now he's a CDI, you know? And it just shows that, you know, and I just, that was the word. When I said diversity, I think that kind of took the lead. And then from there, you see activists kind of promote that as well, because I'll not just me, I'm not going to take the credit, but there are also HIM professionals out there. Glenn Krause, let's see, Paul Evans out in the West Coast. He's very vocal. There was other individuals as well that were talking about it. I know Actis was talking about this as well. They created it in their podcast episodes. We just kept on talking about it. And so if you keep on talking about it, the industry will eventually make the change. But if you, from the time that they make the change, don't stop talking about it, because if you stop talking about it, it's just going to regress back to where it was.
Yeah. We have a comment here from Tina. Tina's saying that it's frustrating that the cost of schooling is getting so high. And I definitely agree with that. I think that's one of the nice things, though, about medical coding is that you can come in from a very entry level point. Like you can be someone who just gets technical training at a business school, community college for a low cost. But once you're in and you're working at a healthcare organization, so many of them have amazing reimbursement policies for people who want to stay with them and get higher education. I mean, I'm talking like 90% tuition reimbursements. I've even seen a couple that are like 100%, depending on what kind of agreements they have with maybe a college that they're associated with. So I think that is one of the benefits that we do have working in healthcare, is that, you know, it might get a little bit hard to get into sometimes, but once you get in, you can just have so many opportunities to just move up and grow. I mean, I love telling people that I am a very proud community college girl. I have a certificate from my community college. That is it. But I took every single opportunity that was thrown at me when people were like, I don't want to do this stupid project. I don't want to do that stupid project. I'm like, I'll do it because I want to get the experience. Yeah. And then, you know, you build up just kind of the same way you've built up. You do speaking engagements, you write articles, you get out there, you do the things that are things that no one told you to do them, right? No one came to you and was like, hey, Brian, you should start up a podcast. Hey, Brian, you should start up a Facebook group about medical coding. Like, it's those things that you create them and they grow. I can't even tell you just how recently in the past, like maybe month or two, I'm starting to see new YouTubers pop up. And I think, you know, there's a pretty good, I mean, I'm not going to toot my own horn here, but I could say it's probably
just toot it, man. Come on. Just do it. You're already there. You're at the top. Just keep tooting. Toot, toot. Come on.
I think there's some influence from myself and others. Probably.
I don't know why you stopped. I remember there was one time I know in the stories, you're like, I don't want to toot my own horn, but I'm going to show you my monthly. I'm like, come on, just toot it, girl. Just toot it. Just come on. It's okay. You're at the top. You're there.
Oh, it sure as heck doesn't feel like the top. I mean, I do okay. I do okay.
You're doing great. You're doing great.
I think people think I'm a lot higher up than I am. Like I kind of get this impression that people think I'm making a ton of money and I have like vacation funds and this big fancy house. And I'm like, I don't. I live in like $135,000 split level house in the suburbs, like next to a creek and across from a field. Like it's good, but it's not like fancy or anything like that.
Right. But you're doing it. You are doing it. And that's what's very admirable is that you, I'm going to keep on tooting that horn when that time that you, and I've always said it in my podcast is as I looked at the time that you were at your screen And you said, I'm about to submit my resignation letter. I'm like, wow. When you did that, you actually motivated me, because I'm like, I got to get to that point. And so I also talked to Stacy Buck. She has a podcast too. Who cares what Stacy says? And so before that, she said she's now making good money just on her own time, right? And so when you listen to her podcast, and I know you're at a point where maybe you're not at to where Stacy's level, but I think you're getting up to where Stacy's is at, where you can manage your time, you can control a lot of the stuff, but you'll get there, and then you're doing the work, you're doing all this stuff. I'm very proud of you.
Oh, thank you, Brian. I appreciate that. Now, you've been taking on a lot of projects lately. You've been the podcast, the Facebook groups. You're like, hey, Hitnots is leaving. Yeah, I'll take. Give me that.
Yeah.
Give me that. I'll take Hitnots too.
Yeah.
Does anyone need me to start a group for jobs? Which you better not, because codersdirect.com already exists. Jobs for American Medical Coders already exists. You do not need to add one more thing onto your plate.
I agree. Don't think about it.
But you're doing on a lot. So how are you manage? Like, are you okay managing all of that? And your full-time job and your family? I'm
okay. I had a podcast episode with Juan Sancho, that medical coder guy, right? And so he said he didn't say, I didn't release it yet. It's going to be next week's episode, but he mentioned, I admire your systematic way of looking at things, or the way you systematically work all of your stuff. And so when he said that, I'm like, I'm systematic. I'm like, but let me go back to you. Let me go back to you again. Toot your own horn, right? It goes back to your podcast episode when I interviewed you, right? And I kept on asking you questions about, how do you do this YouTube thing? How do you do this YouTube thing? And what did you do? You turned the other way. Turn to your desk. How do you turn to your desk? Like that. You went like this. Yes. And then you brought out this
my folder.
Yes, your folder. Yeah, you brought out your white folder. There you go. Yes. There. So you brought that out and you says, I just plan, right? And so what I did is, I don't know if you could see it. There's a whiteboard over here. I don't know if they could see it on the screen. Oh, let me pull it in, right? So when you're talking about all of this stuff here, I'll put it behind me. When you're talking about trying to manage work, school, and all the stuff that I do, and people telling me, take a vacation, Brian. And there we got Lori Woods. Lori, hey, Lori, happy birthday to Barry, 60th birthday. See, I told you. Happy birthday to you. And so it's her fiance's, right? Fiance's birthday. Barry. So happy birthday, 60th birthday. But it's all about planning, right? So I plan, I do a lot of writing, which I hate to do, right? And so when you showed me that content book, I'm like, I have to write. I have to write down my thoughts. And so, I have all of this stuff here. I have a notebook over there. I just start writing stuff down, right? And I'm like, okay, what do I do with it? I have everything laid out, because if I keep it in my head, I'm going to forget it. And so that's what I do. I put it down on paper. And then from there, it's like, what can I manage? What can I do within my own time? So that's where prioritization comes into play. The CEO of my house is my wife. So if she says we're going to dinner, and you have to see, Stacy Book told me to go on vacation, right? That's what when I posted that, Stacy, when I posted the thing about the jobs, it was just something that kind of came out, because I get what I do in my groups is I get feedback, right? And so one of them was, everybody was posting jobs, and I'm like, this is not a job posting group. And so I think it just got into a conversation. I'm like, let me try and do something for the members, and that's what it was. That's what it came about. And then one of the first comments was, Stacy, you need to stop taking a lot more than what you can be doing, and get on a vacation. So I will plan for that. But the thing is, I like to keep things going, just like, trying to take care of a podcast, trying to take care of your YouTube. If you stop your YouTube, you would go crazy, right, Victoria? Yeah,
probably.
You would go nuts. So
probably.
And so that's how I am. I'm very much, I got to be into it. But I know, so I talked about planning, prioritization, and right. Number 3 is setting your limits. I've had times where, like, I'd taken on projects and do stuff, and it got to me, I was at a point where it was very frustrating. I'm like, this is not fun at all. So once it gets to a point where it's not fun at all, then that's where I deprioritize that function. So case in point, when I did the YouTube channel, I got the lights, I got the camera, I was promoting all of the lenses, right? I got the $100 monitor, I got the 132 what is it? $132 what's that thing? The
teleprompter that you bought, Brian, that you've not used because now you don't want to script anything out.
Yeah, I don't want that. And then from there,
whatever works.
What got me away from the scripting was I just didn't like the time that it took away. Because when I scripted, I was spending 2 nights scripting, just writing and researching. And I'm like, this is too much time. That's where it didn't get fun until I picked up the hold on. So I picked up, this camera here. I've had this camera for a while. It was just for fun, the DJI Osmo. And I picked it up and I just started to talk to it. Whatever random thoughts came to me, and I have a lot of random thoughts, I decided to talk into the camera. And so these were like 2 to 3 minute clips. And I just, stuff that came from even referencing the podcast, I just put them into one episode. And so I'm like, this is a great idea. And then from there, I take the little clips from there and then I create more episodes. And then I put them into different platforms. And that's where I'm at. And then from there, TikTok is more like, just some fun. That's really fun. Is. What I did before, it's an evolution from what I did before in Medical Coding Geek. I would, kind of search through, on my spare time, find something funny that was going on with a meme, like a video, and then I would attach a code to it. I would put it out there. It got great feedback. And so I figured, let me do this with TikTok. I think when you find the music, when you find the people doing the dances, my kids kind of cringe when they see me do it. They were laughing, but I'm like, Daddy, why are you doing that? I'm like, hey, I used to dance from back in the day. Why can't I do it? These are like, they're bringing out a lot of the 90s music. And I'm like, okay, I used to dance in the 90s. Come on now, in high school. And so
my daughter thinks it's super cool. She's a couple of times just come in here while I'm like making a video or sitting at my desk, and she just like pats me on the back and she's like, Mommy, I just want to let you know you're an amazing medical coder. And like, she used to not even grasp like what it was medical coding was. Okay. And I think you had your kids on your podcast and kind of touched on this.
They're not interested at all.
But I basically had to explain it to my kid. I'm like, mommy's job is to help doctors get paid for all of the good things that they do. So now she's like at least gotten a little bit of an idea of what it is that I do.
TikTok's where's that? I mean, I like compared to any other platform, it's very engaging. It's somewhat very similar to Instagram. I get, since I started the TikTok, it's not where it is right now since I just started it, but I transfer a lot of the stuff into Instagram and it gains more engagement versus Facebook. Facebook is not even, it depends. It really is sketchy. It depends on what kind of content you create out there. And that's the reason why I put it out there. Like what are people reacting to? And if they're reacting to this, that's going to get on my vlog now because that's what people are talking about.
It's interesting to see just the experimental phase, that when you're just kind of making stuff and putting it out there, what kind of picks up. Like I had one video that I talked about plastic surgery or something, and it wound up getting like 100,000 views. And I saw that. Where did this come from?
Yeah. When I first started, when I created my profile, when you kind of flip through a lot of the stuff and even researching like medical coding, medical this, medical that, it was plastic surgery. And so when you said that it gained traction, I'm like, really? And so when I looked at it, I'm like, that's the reason why, because everybody's interested in plastic surgery. And you've done that in your past.
Yeah. So we're almost close out of time,
sure.
But I just want to say like one last question. So a lot of my viewers are students, they're newly certified. They're looking to gain some additional insight into the medical coding, HIM, industry, healthcare world. So what kind of value and insight do you think they could get from following you on some of your outlets, your social media outlets, your channel, TikTok, etc.?
When you, I have to translate it. If you were with me, like if you're a student and you came to me to mentoring, I think this is the closest thing you would get because it's a vlog format. I pick up things that are along the way in my group, Medical Coding Geeks, even the HIM group. A lot of students are in that group, and I see the activity there, and I pull from it. I said, oh, here's something interesting that I could talk about. I do that. I just did one right now about networking and being an introvert and being an extrovert. How students are now being required to interview professionals for their assignments, which I think is really great. Yeah. The person that I helped was like not interested in that. She thought it was it was too rough. I'm like, no, that's not rough. You got to start now. You got to start now. Second semester, you got to start now, because once you get out there, you have to carry that forward. And so what's nice about that is that she is now realizing that I have to do this more, because I've helped her with create connections and finding those professionals to get her assignments done. So it's kind of like a win-win for her. But when you go to the YouTube channel, you're getting me. You're just getting me. That's it. You're following me. You're following what I do. So I know there's a lot of feedback like, oh, can you do this type of coding? Can you do this type of coding? But I know up front when I did my first video, I know I don't do outpatient coding. I don't do physician-based practices. I don't do E&M. I don't do podiatry. I don't do interventional radiology. I don't do any of that stuff, right? So don't expect that to me, but it's not going to stop me from trying to figure it out. Because if you're going to come to me as a student and you're asking me about it, well, let's kind of figure it out together, right? And so because of that, if I don't know, I'm going to ask people like yourself, like other professionals, and get them connected. And I've done that with students. I've done that with professionals. I've done that with my podcast. You can expect that now with the YouTube channel.
Awesome. Awesome. And now you're going to start live streaming.
I don't know. Don't get me started. I just here's the thing to Victoria, right? So I was getting my car serviced today, right? And I am thinking about it. So I checked out your stuff. I looked at I know we had talked about gamers, right? Mm-hmm. And their equipment. I followed them. I wrote down Elgato Stream Deck, Elgato Cam Link, which is pretty much the equipment to get started. But I am not there yet. I'm going to take your advice. Start with the business first, get the foundations right. Okay. Yeah. See, yeah. So my wife says she says she doesn't want to work anymore. So I told her I have a 5-year plan. And then I asked her, what's your 5-year plan? She says, you're my 5-year plan.
Awesome. So we're a little bit past time, but this was so much fun. We had a great time. Just 6 minutes
already.
Yeah, I know. So before we go off, any last words of wisdom you have, Brian? Anything I didn't cover that you want to mention?
I always kind of end things off by saying, look, if you really want to get noticed, create content. It doesn't matter what it is. It doesn't matter what people think. Just create it. If you create it and just keep on creating and be consistent, it'll happen. I mean, there are people who've created podcasts. Stacy created a podcast because I've bugged her because she has enough. You want to call me? I'm going to call everybody out too. So Stacy created a podcast, right? Because I told her, right, that she has enough content, but she didn't realize that. But if she didn't get it started, it would never have happened. So any professional, student, even students, create content based upon what you know. People like your experience. People like relatability. Even as a student, as a professional, they'll connect with you. And so that's how I did it. Start small, build your portfolio, and then you'll grow.
All right. That is amazing, Brian. And thank you so much for coming on the stream again.
Thank you for having me.
Appreciate it. We are going to say goodbye now. I want to say thank you to everyone in the audience, to Stacy, to Lori, Patty, Karan, everyone, Pam, who's on today. I will see you guys next time. And until then, you just keep on coding on. Toot toot.